Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to go over how to study for maternity nursing in nursing school. In my previous videos I've covered how to study for pharmacology, medical surgical nursing, fundamentals, and all that. So if you're interested in those videos, be sure to check those out. So in this video, what I'm going to talk about is why students have issues in this class. I'm going to give you some quick study tips on how you can study for this class and make it easy. And then I'm going to cover all the areas that you should be covering in your maternity class and hit the highlights of things that you're going to be tested on your exams. So really, you could use this and refer back to this video whenever you're fixing to take your final in your maternity class, because this right here is usually everything that's going to be hit on a final exam, a comprehensive exam. So first, let's talk about what this class covers. Well, of course, it's going to cover the birthing mother. It's going to cover the prenatal part, the labor and the delivery, the care of the newborn, the postpartum, and the postnatal. Now, most students absolutely love this class because majority of your nursing students are women, and a lot of women and some men, they want to go into maternity nursing. And women can really relate to this class because they've either had children, so they've been that mother who's going to have a child, so they can relate with this class and they find it interesting. However, some people do not like this class. It's boring for them. It's not their interest because they want to go into ICU, they want to work in cardiovascular, they don't want to work in this type of specialty, so they find it a little bit difficult. Regardless of if they love it or hate it, this class covers a lot of material in just one semester. Normally you just have one semester of this class and it's a whole bunch of stuff you have to know. So I recommend that whenever you're studying for this class, you do a focused study. Hit the highlights of what you need to know for exams. Okay, study tip number 1. I recommend that you get a study guide. I'm always talking about study guide. And the study guide I recommend for this class, I really don't recommend like an individual study guide like how I have in the other classes. I recommend the Saunders Comprehensive NCLEX RN Guide. This is that book that I've always talked about. It's a really thick book. It covers all of your nursing lecture classes in it, and it has an excellent section. I think it's like 5 or 6 chapters, depending on what edition of the book you get, that's dedicated specifically to maternity nursing, and it breaks everything down so easily. And also, it comes with a CD with questions that you can practice specifically on maternity nursing, which I'll get into that here in a second. So get this book. You can not only use it for this class, but your other nursing classes. Okay, number 2. Use your study guide as a supplement and compare it to like your class notes, your PowerPoint, and your textbook. And make sure you're paying attention for repeated key concepts in the book. So if it keeps harping on APGAR scoring in your PowerPoints, in your class notes, and then in the study guide, that is probably going to be some test material. So make sure you know that. So that right there is telling you, hey, this is probably going to be a test question. So memorize that and completely understand it. Okay, 3, practice specifically whenever you're preparing for your maternity nursing lecture exam. Say you have a lecture exam coming in 2 weeks. Be practicing those questions, specifically NCLEX style questions for maternity nursing, because that's what your professors want to use. They want to use NCLEX style questions. And what is so great about this class is that maternity nursing is very specialized. So you're going to see the same questions over and over because it's just so focused, and it's really the only thing they can really pull questions out of. So whenever you're practicing these questions, chances are you're going to see this type of question again. So that's one thing I liked about maternity nursing. Okay, and number 4, I think this really helped me. I noticed this pattern in maternity nursing, that anything that has like a weird name, like in maternity nursing you'll hear about Chadwick's sign or Goodell's sign. This right here, if you hear someone's name that they've named a sign after, that's probably going to be on an exam. Or anything that's like an acronym, like the APGAR scoring or the HELP syndrome, that's going to be on an exam. Or anything that's in a stage, like for instance, the stages of labor. I remember those were really big test questions. Or the menstrual cycle, asking when this was going to happen on what day. Or like fetal development by weeks, like what happens in the 20th week, what happens in the 38th week. Always memorize that and try to commit that to memory because that's going to be on the test. and anything that's like a scoring tool. For instance, like the Bishop scoring and the APGAR scoring. That will definitely be on a test as well. So let's hit the highlights of areas that you need to know in exam. Now, in your lecture class, you'll have like probably the first exam is going to cover maybe female reproductive system and assessing the pregnant mom. And then the next exam is going to cover prenatal and pregnancy risk. And right here, I've broken down section by section on what you're probably going to be asked on your test. So make sure you can, like I said at the beginning of the video, just refer back to this video so it can help you guide you in studying, so you can look at your study guide, look at your class notes, and see if I mentioned it. Okay, first, you're probably going to be going over the female reproductive system. That'll probably be the first thing you cover in the first part of the semester. Know the menstrual cycle. It's especially the phases, what happens on each day, because a lot of times they like to hear, they'll ask you about hormones, when they're being released, on what day is this hormone released, whenever the egg's released, so make sure you're very familiar with that. And the different types of female pelvises, which ones are good for birth, which ones are not. The umbilical cord with the fetus, they'll ask you how the arteries and the veins work, and how many of there are there of each. So be sure you know that. The function of the placenta, how it works, and how and when fertilization and implantation happens. Fertilization happens in the fallopian tube. That likes to trick a lot of people. So remember that, how long it's being fertilized for, and then on what day does it implant. Know when that happens, and then also know, like I said at the beginning of the video, the fetal development week by week, what's happening to the fetus as it's developing up to the 40 weeks. Okay, next, assessing the pregnant mom. Make sure when you're studying this section that you're paying close attention to those specific maternity lingo. For instance, gravity, parity, a big thing, they love to hit on this on exams where they will say, the mom comes in, she's had this many children, what's her gravity or parity? And then also it likes to hit on this acronym, the GTPAL. That stands for gravity, parity, term births, abortion, living children, and it'll give you this whole scenario, and you have to pick what numbers these are and put it in the right acronym. So make sure you know that. Nigel's rule, this is a rule that you use in order to calculate a woman's due date. They'll give you, this was the woman's last menstrual period, use the Nigel's rule, and come up with the due date. So know how to do that. The signs of pregnancy, specifically not just the nausea and the vomiting, but those signs like the Chadwick signs, the Goodell signs. And also risk factors for whenever the woman is pregnant, if she has HIV, hepatitis, and how the fetus is affected, what education you give the mom, and things like that. Okay, prenatal, things that you need to know during this. You need to know what's normal physical and mental changes that the woman is going to undergo and how to educate her, nursing interventions, on how she can deal with this. And diagnostic testing, this is a big one. Things that are ordered for the pregnant mom throughout her pregnancy, like when it's ordered, what the prep education is for the patient, and how you prep for this as a nurse in your nursing interventions. For instance, like an amniocentesis, when's that performed? How is it? What are you going to do afterwards to care for the mom? Another big one is the non-stress and contraction stress test. And a lot of times it'll talk about that and say that the mother had one, and then it'll tell you the results, and you have to know what those results mean. And it's a little bit tricky, so make sure you really look at that. And of course, nutrition education, like the pica, what she needs to eat, if she's diabetic, how she manages that, all that, review that. Okay, pregnancy risk while they're pregnant. No conditions that put the mom at risk, like for instance, what are you going to find on assessment? How are you going to educate that patient on managing it? For instance, like an ectopic pregnancy, if they have that, how is a patient going to present clinically? What are they going to be complaining of? What are you going to do for that patient? And again, that study guide that I was talking about really breaks down all these sections for you, highlights and tells you what you need to know. It even has triangles about the important information that's probably going to be on exam. It's a great book. Okay, then the labor and delivery part and its risk. Big thing that you need to know about this, I can remember test questions about this. The stages of labor, there's 4 stages. You need to know what's happening during each stage, how the cervix is dilating, very important. how to differentiate between true and false labor. Fetal decelerations, another big one. I actually made a video on that. You can check that out. A card should be popping up or a link in the description. I go over fetal decelerations. It's a very basic thing over that you just need to know for NCLEX. So you need to know that. The different types of fetal monitoring, your Bishop scoring, breathing techniques, how you help the mom breathe through her contractions, types of delivery versus cesarean, vaginal. And then another big one, prolapse cord, placenta previa, abruptio placenta, and what you do for that. I remember questions about that. Know the nursing interventions, how it's going to present, because it'll tell you what's happening, and you have to tell which condition out of the 3 it is. So know that. That's very important. And pain relief for the mom during labor. Okay, postpartum and its complications. Know what's normal and what's not normal during the postpartum period, like the lochia, how much bleeding the woman's having. When, at what stage, at what week will the uterus form back to its non-pregnant state. And breastfeeding care and complications, latching issues, mastitis, things like that. Newborn care, again, know your APGAR scoring. It'll give you, a lot of test questions will give you a scenario, and it'll say the infant was this color, had this, had that, and you have to add all that up and tell what their APGAR score is. So make sure you know that. Make sure you know normal vital signs for a newborn, because it's not the same as an adult. The nurse's role after birth, what you're doing for that infant. They're getting medications, they're making sure they're getting warm, you're checking blood sugars, things like that, what you have to do for that infant afterwards. And no complications that that infant can have, such as the respiratory distress syndrome, torch syndrome, and jaundice. And know about that, but know what you do for the baby as the nurse and how that baby may present clinically. Okay, and last but not least, all this is sort of an umbrella for all this. During all these sections, you need to know medication-wise what meds are usually used during labor, like Pitocin, what you're going to watch out for, things like that. Medications that you're giving the newborn after birth, the vitamin K, the eye drops. How to start and stop labor. There's a lot of medications that you would use to stop a woman's labor and medications to start the labor, an induction, and the pain relief. So know your nursing interventions and side effects with all that. So that is a little bit how you study for maternity nursing. I hope this helps you out, and I wish you the best of luck in this class. And be sure to check out my other videos on how to study for your other classes in nursing school. And please consider subscribing to this YouTube channel.